China is no longer counting all COVID cases, as authorities stop reporting what is classified as asymptomatic infections. This comes amid concerns that the healthcare system will come under greater pressure in coming months. Chloe Feng has a story.
China's abrupt pivot from COVID-0 is continuing. The National Health Commission says from today it will not report what it classifies as asymptomatic cases. It said it's hard to gauge the number of asymptomatic patients, as many no longer take PCR tests after mass testing practices were scrapped. But it will continue reporting symptomatic cases, although the figures do not reflect the country's actual infection situation. The mainland, with a population of over 1.4 billion, reported only 2,291 symptomatic COVID cases for yesterday. That was a sharp decline from Monday, when it registered 2,300 symptomatic and over 5,300 asymptomatic infections. Responding to the drop in reported infections, Li Chun, a senior official of the Chinese Center for Disease Control and Prevention, said it was due to the overall smaller number of PCR tests because testing procedures are now voluntary. As many asymptomatic patients choose to stay at home instead of seeking help in clinics, the numbers will be lower. China is now bracing for a potential tsunami of cases in winter, as the healthcare system is already overstretched. Experts urge the authorities to accelerate the approval of updated jabs. Health officials, meanwhile, announced plans to roll out the second COVID vaccine booster shots for high-risk groups and people over 60 years old. Despite relaxing COVID rules, Beijing is eerily quiet. Restaurants and shops were mostly closed or empty, even on the usually busy street near the Palace Museum, as many businesses are having difficulty finding enough staff who haven't been infected. Chloe Feng, HKIBC.